COVID-19 caused by the coronavirus originated in China's Wuhan city on December 31st, 2019. China confessed to the World Health Organization about a cluster of cases of pneumonia. On January 9, 2020, the WHO issued a statement saying Chinese researchers have made preliminary determination of the virus as a novel coronavirus. Within a few weeks of this, the virus took over the world. The test case of human-to-human transmission was acknowledged by Vietnam and Germany. It's been 160 days of nationwide lockdown and human health is at stake. The worldwide cases crossed 25 million and the death toll has reached 840,000. India has also been very badly trapped into this, with 3.54 million cases and over 63,498 deaths. The COVID-19 widespread seems to be leveling off with every passing day. This global pandemic requires a global response. The whole world has come together to figure out a treatment, a medicine, or a vaccine. Many renowned medical councils like the Indian Council of Medical Research, also the Oxford University and Serum Institute of India, and others have come up with different solutions. So far, no stable medication has been found. Considerable relaxation of the lockdown is being seen across the world, but there are many questions still unanswered. The level of panic is increasing with the increase in death risks. The world is in complete turmoil due to the ongoing war with COVID-19. Many countries have come up with different economic relief packages, but has it really worked? And has it satisfied the need of the people? According to the International Labour Organization, the world lost nearly 400 million full-time jobs in the year's second quarter, April to June 2020. The virus has plunged the global economy into its worst recession since World War II. The nationwide lockdown has confined humans to their homes and has caused financial burden on the world. Social distancing and emotional and mental distancing has also impacted humans dramatically. Democracy News Live Bureau, New Delhi. Good evening and welcome. We are here to discuss with Dr. Pavitra what are our challenges when we look at COVID, coronavirus. How do we see it? The world has looked at this virus as something which has emanated from China, possibly manufactured by China. And here we stand today after many years of research, and we're still struggling with it because it isn't an easy thing to fight a virus. People may have all kinds of theories around it. It may work for nations or for small groups of people to run other people down. And understanding how this virus unfolds, how do we have to fight it, and how long this fight is going to last. So let me introduce Dr. Pavitra. Dr. Pavitra has been around in the business for a long time. She's a virologist. From 2006 to 2012, she studied the virus. So I'm going to start this conversation with her today to kind of understand where we stand in the fight today. Dr. Pavitra, welcome to our show. Let me start by asking you, how do you see the fight against coronavirus going right now?
Hi, Rohit. Thank you for having me over. Today, we're in a stage where we understand a little bit more about this virus, where we definitely know how it spreads and how it doesn't. So, we're in a stage where we are also developing vaccines that are coming along at breakneck speed like never before without compromising safety factors. Not all of them, but some of the good ones that are coming up are looking really promising. So in about a year and a half, we are looking at taking good control over the spread of this infection.
So when you say there are some good viruses and maybe there are some good vaccines and maybe some not, so good, what do you mean? Because people look at it and say, there is a virus and you should be able to kill it. Here is a little, vaccine. Basically, these are bodies which need antibodies. They will be able to kill them and they'll be gone. So why so long from when we talk about starting of finding the vaccine to when we reach the end of it?
A vaccine is disease specific. You cannot treat one infection with another vaccine. So it needs to be designed, developed, tested for this infection. So COVID-19 was initially discovered in December of last year. So, and we have had such good technological advancements in the field of biology that we were able to sequence the virus and look at the parts that are needed to make the vaccine. And one of the studies that's based out of Oxford, I think it's called COVID-19, if I'm not wrong. Anyway, it's headed by Dr. Sarah Gilbert. They have done an excellent job of building this vaccine on a previously well-studied model of a different coronavirus. And then they've tested the safety on people. They've also tested in smaller groups to see whether it will produce an antibody response or not. You want a robust and consistent antibody response, which they have shown and published. And now they are testing it in large populations, because the small population is mostly healthy volunteers. You're not going to see if there's any problems of underlying conditions. Let's say if a person's pregnant or a transplant patient, whether you can give it to them or not. All these things are being done right now. And that's one of the front runners for the vaccines that are being developed right now, that we can look forward to, that we have a lot of hopes pinned on.
So when you talk about corona being the new corona, right? The older corona means there was coronavirus before. Now this is the novel coronavirus, right? The COVID-19.
Yeah.
So tell me, how long have you been studying the coronavirus?
Coronaviruses were discovered in the early 1960s, the family of viruses. So when I say family, think of fruits, okay? Fruit is a family, and then mango is one type of the family. So coronavirus is like one small part of what a fruit is, or different types of fruits. And then you have different types of mangoes. You have different strains depending on where you live and things like that. So different coronaviruses are completely different strains. One type of mango is not going to taste like another type of mango. So this is a completely new virus. We have had extensive knowledge on how this virus replicates in the cell, and we actually have been, there are vaccines against coronaviruses that infect dogs. Veterinarians are very aware of it. And people in the veterinary industry actually know a lot more about coronaviruses because they cause a lot of commercial damage if there is a coronavirus infection in different animal species, especially turkey, chicken, dogs, cats, and most of these commercially important strains. Human coronaviruses generally cause a very mild common cold. Generally, I'm not saying always, generally. In fact, they're so common that 1 in 3 common cold is actually caused by a coronavirus. So you and I have probably had some other strain of coronavirus in the past. Now, when did it become scary? When SARS coronavirus came out in 2002, we realized, hey, this is not just something that we can sneeze a few times and forget about it. And now this has the potential to spread worldwide. But we were able to tackle it using very sound scientific methods. And then there was another coronavirus called MERS that came out of the Middle East that was a lot more deadly than this virus, but for some reason didn't spread very well. You still get 1 or 2 cases of that MERS coronavirus, but it's under control. The origin of another coronavirus, that what was called novel coronavirus, which is now causes COVID-19, was not unexpected in the field of infection and virology. So when this came out, people in the field weren't very surprised because we already knew that infections that spread by droplet can cause a huge havoc worldwide. So that's the journey so far in getting from knowing what a coronavirus is to where we are today.
Dr. Venkat Gopalan, very important question from my perspective. You know, when we've seen over the last few months, I've seen presidents of nations and, you know, all kinds of people blame the Chinese, saying, you know, this is a man-made virus which escaped. The Chinese were testing this. Call it the Wuhan virus, call it the Chinese virus. Do you think it's fair to call it a Chinese virus or a Wuhan virus?
Scientifically, you
Almost saying blaming them for this whole outbreak and pandemic.
so a little bit of a longish answer coming up here. We almost always never name an infection after the place of origin because as humans, we tend to hold on to a lot of biases. So we don't want the origin of the infection doesn't matter as much as the infection itself. And one of the reasons that some of these viruses have originated in China is because these are called zoonotic viruses, meaning they came from wildlife to some domesticated animals and then to humans. It so happens Chinese have a very close contact, and they have these huge animal farms and people go work in these farms. So the chance of them getting a whole lot of novel infections, unfair to them, but is very common. And based on the sequence, that is the genetic sequence of the virus, we know that it mutated from bats and came to humans. Whether it came directly to humans because there was the person working in the animal farm came in contact with the bat feces or something like that, or whether it came through an intermediate animal, we don't know yet. So it just so happens that this is how the infection transmission happens. This is absolutely by no means a biowar, a lab developed infection. And people say, oh, there's a virology institute in Wuhan. Yes, that's precisely why we found out about this infection so quickly. When was the last time we found a new infection and started developing vaccines within the last, say, 7-8 months? It's never happened. We should, in fact, be grateful that we had access to all these extremely good researchers who gave us this information at the earliest.
Dr. Pavitra, you're actually making a very huge statement. A lot of the world leaders and, I don't know how many people I've spoken to around the world blame, squarely the Chinese for having developed this virus, done this biowar. But what you're making is an amazing point, saying that this ain't a biowar. This isn't a man-made or human-made virus, as we call it. It is something that came from animals to human transmission and then spread. And the very fact that we are sitting here today and still finding a vaccine so quickly, it's because the Wuhan lab existed, which means you are complimenting them. But here is one other bit of this. Many people say that the Chinese held on to the information and did not stop the control that quickly. Even after they had found out, they did not take enough action. I'm not so sure if, as a virologist, you would like to comment on it, but do you think, was there a way of having caught it more quickly than you said that they caught it?
See, I don't know. Because at that point it becomes a public health issue and I'm not an expert on this. And for the most part, when you hear hoofbeats, you think horses, not zebras. So you think it's something else that we've come across before and you think you have a handle on it. But clearly that wasn't the case. Whether there was a delay, like, and hindsight is 2020, we can always go back and say, oh, you could have done it better here. I don't know. I don't know what the on-ground situation was. So I can't comment on it without any more information.
Great. No, I completely respect that. Now, where do we stand for the fight here in India? So let's say you're saying about a year away, we will see a solid vaccine, which means it's not happening now in December, which means this year is going to extend. So tell me that. So you think we won't have a vaccine by December where we'll be able to go and start using it?
I would love it if we could have it. If we have the safety data, efficacy data, and our country is one of the best at manufacturing them in bulk. If that happens, I'd be the happiest. Trust me, because we all want to get back.
But where is the but?
Sorry?
But there is a but there, I see.
The but is we need data. We need data. We need solid evidence-based data that says this works and it's safe. That's what we're waiting on. So we'll just have to.
So you're saying the vaccine is almost a year away?
That's what I would say, but I have not seen the data. So that's just me maybe I'm a little bit of a pessimist where I'm like, if I say 3 months and then it doesn't come, I'm going to get disappointed. So in my mind, I've set it as 1 year from now. So I will live a hermit-like life for the next year, and then hopefully things get better is my mindset.
So, going on from here, as a virologist, you understand how virus spreads, how it unfolds. What do you recommend to people? What are the next few steps they need to take for the next whole year? Because people have to safeguard their existence, they have to run the economy, they have to run their homes, eat their food. Everybody may not be able to sustain. As we move forward, what are the steps you would recommend people make to make sure that we can fight the disease and not let this spread happen?
The basics work. There, you have to wear a mask that covers your nose and mouth. If you can avoid going out, avoid going out. But that's not possible. We all have jobs. We all have to go out and get it done. So be as safe as possible. One of the simplest things is we're all social creatures. It's hard not seeing people. We go crazy not seeing people. So even going to the office is a social event, social gathering. We sit together, we share lunches. That's what we do as people. But avoid that if you can, to the best of your ability, because you have to stay safe for your own sake and your family. Maintain distance when you go out. It sounds like, oh, she's saying the same thing over and over again. It doesn't sound novel. What's the point of a PhD? But the basics are the only ones that still work. We still have to follow that. There is I'm going to be a villain here, but there is absolutely no magic pill, drug, juice, tablet that you can take that will help build your immune system, that will stop the virus from coming to you. There's none of that. The basics work. Mask, social distancing, avoiding crowds, and keep your hands safe. It sounds really boring, but it works.
But so when people come out and say, drink this, and this is the thing you need to drink, and this is the thing you need to eat, and your immune system is going to be better to be able to fight the virus.
Yeah,
does it not work?
Most of the time it does no harm. You feel a little bit better, but what happens is when you take it, you tend to become complacent and you don't follow the basics, and that's when the spread happens.
Right. So you're saying continue building your immune system if you want.
Out there selling stuff, but follow the basics. Everything else you can do if you want to.
Okay. So what you're saying is that do the basics, have your mask and all of that. One, there is not going to be a vaccine just right away, and at least a vaccine that you can trust. Two, if you want to have your immune little, system boosters, if you wanted to call it that, then have them, but it's not as if that's going to help you fight the virus. You have to just protect yourself.
Boosting your immune system.
Okay.
You can. You can. Okay, let me rephrase it. You can boost your immune system if you eat really well, like a well-balanced diet. You sleep 8 hours, and then you get exercise, and you have low stress. Please tell me, which of us has all these? I mean, unless you're a 2-year-old, you don't have any of these. So you can't boost your immune system in any way against this virus. So you just got to do what you have to do to keep yourself safe.
Now, when we're talking of, is this the way for the rest of our lives? Once we find, a way of fighting this virus with a vaccine, do you think human life from here on will continue in this mode of being, physically distanced? Or will we go back to our normal?
Oh, if the vaccine is effective, we'll all go back to being the big social creatures that we are. Going out to dinners, huge weddings, birthday parties, whatever it is that you want to have, we will go back. And that's why everybody's working so frantically on this, because honestly, this whole lockdown aspect of life is depressing. Whatever work that you do, it is depressing because you're sacrificing so much for your own safety, but at what cost? Your mental health is also affected. Sometimes your work is affected. You don't get paid. So what do you do? So it's not just a matter of saving lives, it's about keeping people mentally healthy as well.
So, Dr. Pavitra, there are many vaccines around the world. I have literally heard of dozens and dozens of vaccines around the world that we're talking about.
165 trials, candidates as of August 20th.
The Russians say they already have it. Mr. Putin has given it to his daughter. The Israelis say they have it. Each one of them says they're good to go. They're testing it on, populations. The president of a nation tested on his own daughter. He certainly believes in it, right? Is there a way for us as the world going forward to pool our resources to try and do this together? Or is this a strategy of, going in multiple directions and trying to find out a final cure for the disease?
So all these vaccine candidates are based on sound science. They're all based on sound science. So I will not question any of them in any way. All we need to see in terms of data is what works effectively and what works keeping everybody safe. So there's no harm in all these candidates coming up. And let's say there's a couple of them that are good, then you split it among the world depending on manufacturing capabilities and get everybody vaccinated.
Will the program of vaccinating the world with the coronavirus, the COVID-19, antidote, as if you want to call it, or, vaccine basically builds your immunity against that virus.
Yes.
Will it be free of cost for the population of the world?
I don't know. It depends on the healthcare system of that country. In India, we do a great job of vaccinating the huge numbers. So I think we have a very efficient system in place to reach people. The cost aspect of it, again, there's not much. I don't know what to say about it because that's an aspect of science, or not science, but public health that I don't understand.
Good. Dr. Pavitra, this has been a very enlightening one. There are lots of, confusion around as we talk about, the race up to finding the final vaccine. And I think this series is going to continue from here. Every Wednesday, we're going to do one more episode on understanding where the vaccines are, what's happening there, and what stage we are at. Thank you for joining us today. You've kind of given us an overall picture of this. So for all our viewers who've joined us today, I want to thank Dr. Pavitra Venkat Gopalan. She's a virologist. She's based in Chennai, and she's been studying the coronavirus for many, many years now. It was an earlier version of the coronavirus, but the coronavirus has been around. So great revelations. This is not a human-made virus, as a lot of people suggested, describing it with a country's name, possibly an insult. So let's all get together as a world and try and find the final vaccine so that we can go back to our normal lives. And thank you for joining us at Democracy News Live. It matters. It's our special on the coronavirus COVID-19. Thank you, Dr. Pavitra.